Hi everyone, welcome to those who are joining us. We'll be starting in a couple of minutes. We're just waiting for others to join. When you're joining, if you have a moment, just please spend a couple of seconds just introducing yourself in the chat box. Joriam has already made a great introduction and tell others where you're joining from today. So yeah, thank you everyone for joining. It's great to have you all here, joining from different places and spaces. Thank you also for joining us over what's probably your lunch break too. Really appreciate your time. And by all means, if you haven't had your lunch yet, please do just grab it and eat it whilst we have this session. It's very informal. So I'm seeing lots of familiar faces, but I'm also seeing quite a few new faces or those who I haven't met before. So to those who I haven't met, I'm Serena and I'm the Innovation and Collaboration Manager in the Q team. I'm looking forward to speaking with you all today. Just wanted to flag that we are missing Olivia Bush today, who's the Head of Community and Networking in the Q team, who many of you will know. So she was meant to be leading and chairing the session, but is off unwell. I know a challenge lots of you are probably dealing with your staff. So you're stuck with me instead. So thank you for having me. And I'm also joined by Beth, Henry and Adriana. So I can see quite a few more people joining when we're getting going. So thanks, Joriam, can see your support in the chat box. So just to give you a really quick run through of how we'll be using the tech today. Subtitles are available. If you want them, you can just click on the live transcript button at the bottom of your screen. And where possible, I know lots of you do have your videos on, but yeah, we just really encourage you to have them on, as we know they can really enhance the discussions. And we ask that you stay muted, except of course when you're in the breakout rooms. Or of course, if you'd like to ask a question or later in your breakout group discussions. But yeah, we really encourage you to ask questions and unmute wherever and whenever you want. This session is being recorded, but these are the main parts of the session in the main room. So the breakout sessions won't be recorded. And if you'd like to tweet about or during the workshop, please do join the conversation and tag the Q community account and use the hashtag Q community space. And if you have any issues at all with the tech through the session, please do message Beth Banfield, who's our expert technical whiz and host. So just to give you a bit of an overview of community space and what we'll be doing today. So through community space in Q, we really want to create opportunities for building community through forming new relationships and deepening existing working relationships. So there's very much a focus on community building. This space is also about giving and receiving support. So with Q always being a hive of activity, the aim of this is also to be contributing towards a culture of peer support, of giving energy to one another, and to continue and persevere with the work of change, improvement and innovation. We hope that this will be a place where you can practice the practices and skills that are necessary to enable and deepen good peer support and collaborative relationships, so that you can use these skills within Q and also in your own work. So in terms of how we do that, we aim to do all of this by connecting around a particular topic to give community building focus. And as a result, we really focus on building the conditions for making the most of these spaces, for spending rich and productive time together. So Henry's going to share a framework and introduce this in a moment, which will be an example of that. So just a quick note about the topic. Hopefully you all know what the topic's about because you're here. It's on co-design and digital change projects. So we know that co-design and collaboration with a diverse mix of stakeholders is really important to consider from the early stages of a project. And it ensures those with different expertise, expectations and perspectives can work together to solve emerging problems and to sustain engagement at all stages of implementation. But it's something we hear quite often across Q and in the Q community. The value of co-design regularly comes up. So we want to explore in further detail, how does it actually happen in practice? So this is a space for you to connect with your peers around this today. So the next slide just shows what we'll be covering today. We'll be finishing by 1:30, if not a little bit before, depending on how we get on. And the workshop itself will be split into two distinct parts. So in the first half, we'll be hearing from two case studies who we're really excited to have join us today. So Mark Beswick and Chen Davies, that demonstrate the value and importance of co-design and how this has had tangible benefits for their digital change projects. So for you, this will be a chance to think deeply, ask the case studies questions, and consider how the learning will be applicable to your work. And they'll reflect on the relational and co-design aspects that have helped progress their work. And they'll be focusing much more on this rather than the content and in-depth content of the project itself, although you can read more about this online. And in the second half, we'll be spending some time in breakout groups, connecting and collaborating with one another around your own challenges that you're facing around co-design in your projects, using a liberating structure peer coaching method called Troika, consulting to problem solve together. And then we'll have some reflective time at the end to make sense of what you've heard today and think about what you want to do going forwards. So throughout the session, you'll meet new people and make new connections, potentially deepening those that you already have and identifying people you want to connect up with more. So I'm now just going to pass on to Henry, who's going to share some principles and a framework we'd encourage you to keep in mind and pay attention to as we go through today.
Thank you, Zarina. So to help make the most of the time you have together, I'd like to suggest some sort of foundations for creating a productive thinking space using the 10 principles of Nancy Klein's thinking environment, which some of you may be familiar with already. And I guess what we're trying to do through these principles is best summarized by this quote here, which is that the quality of everything we do depends on the quality of the thinking we do first. So moving onwards, what does a healthy, productive thinking environment look like? Well, consider the following principles, and don't worry about absorbing and remembering everything. Just try and get a sense of these and see what is sticking with you. Some may mean something straight away, others may just take a bit more time. So the first is attention, and that's listening without interruption and with interest in where the person will go next in their thinking. So as Nancy Klein says, the quality of our attention determines the quality of other people's thinking. And then equality. So regarding each other as thinking peers, giving equal time to think. In a thinking environment, everyone is valued equally as a thinker. Ease, and that's more about where you are at the moment. If you can, try to discard any sense of urgency and ease into a state of sort of freedom and permission. Appreciation. Appreciation is noticing what is good and saying it. And so offering genuine appreciation of a person's qualities. And there's a rule I quite like, which is practicing a sort of 5-to-1 ratio of appreciation to criticism and trying to get that in a nice healthy balance. Encouragement. And so the invitation here is to go to the sort of unexplored edges of thinking by kind of stopping thinking about this as a competition about thinkers. It's actually more about the unthreatened search for good ideas. And feelings. So just welcoming the release of emotion by recognizing that actually unexpressed feelings can sometimes inhibit our thinking. And so in a sense, we don't need to be moderating ourselves or sort of second guessing ourselves. And then information. So absorbing all the relevant facts, because actually we base all of our decisions on information. And if that information is incorrect or is limited, our thinking quality can suffer. Difference. So reality is diverse, and to think for ourselves well, we need to surround ourselves with people from different identity groups and to understand as fully as possible their lived experience. So it's great that we've got such a mix of people here today from different backgrounds. So on to the last two, and these are really, really important, especially for today. Incisive questions, and this is around removing assumptions that sort of limit our thinking, limit our ability to think for ourselves clearly and creatively. An incisive question is sort of removing assumptions and helping to think afresh. And finally, place. So I really love this idea of producing a physical environment, the room, the listener, your body that says you matter. And the idea is that we think more clearly and boldly when the physical environment affirms our importance. So those are the principles, and we're now going to have a short breakout group activity for you to reflect on these 10 thinking components and how to make the most of the session today through them. Some questions to consider: just what resonates most with you and why? And what does this look like in terms of your day-to-day work? When you think about co-design as well, which of these principles stand out to you or do you need to consider? So be in breakout groups of around 3 people, and I think we've got 8 minutes, unless I've talked for too long. So we're going to get going with that. And if you need help, just let us know. We'll post these in the chat so you can view them there. Thank you. This is the pause before the breakout, by the way. Totally planned.
Thanks, Henry. Sorry, I think I started 2 minutes late. So I think it should be, maybe we don't do 8 minutes, we bring people back in.
Yeah, we can close the moment early. I think Anna may have stepped away from her desk because she's not joined. So there's one group. There's a couple of groups with 2 people.
That should be all right. I wonder if it's just for the, I do wonder whether for the Troika, people might also drop off at 1, just because of...
There's often clashes at 1, isn't there?
Yeah, or they just want to drop off after the case study. So we can just adjust that and maybe mix people around. And even if it's a small group, that's fine if you've got 5 groups of 3. But you've got 27 now, so...
Oh, Joe's here. Should we let her in?
Oh, that's good, thanks.
Funny, because when I started talking, I saw the WhatsApp chat pop up.
You could hear it, yeah.
Yeah, this is always the tricky one, isn't it?
Yeah.
Okay.
That's why I like a headset.
Yeah.
You can have.
Oh, I've joined the breakout group, sorry.
Were you here for the beginning? Have you just joined us now? Or?
Sorry, yeah, I've just joined.
Oh,
Would you like to join a group, Joe? Or
oh no, that's fine because I'm just late. So sorry.
we've just spent 15 minutes doing the welcome and intro, and then we'll have the case studies for about 20 minutes or so.
Of course, I haven't missed it.
No, you haven't missed the juicy bits.
they've got 4 minutes and 50 seconds. There's a minute to count down as well. So just nudge me if you'd like to end any earlier.
How many have you got?
Got 27, including us. So
Including us, yeah.
I was saying I wonder whether people will drop off actually when they might not want to join for Troika, but that's also fine because then it means the people who are here are the people who need to be here.
Yeah, I imagine Chen will, if her little boy's got chicken pox, she'll probably pop up, won't she?
But Mark was keen to.
Yeah, that's good.
That's good. Yeah.
They seem good. Joe, if you have any questions, I know you, and you said you might have questions for the case studies. So yeah, if no one else starts, then if you have one, that would be great.
Yeah, but Beth, you probably have some as well. I guess I'm here as well with my exchange evaluation hat on. So yeah, Beth always has good questions when it comes to that. So I guess we can ask ours if no one else has any, or to get them going.
And just for that, Beth, I think we'll be spotlighting them. Like after I've introduced them, we'll spotlight them when I'm going to ask the questions, and then because there's only 27, we can almost probably fit on one screen, like when we do the questions.
Oh, so going to take the slides down for that bit.
Yeah, we'll stop
Lovely.
screen sharing when I start asking them questions.
Lovely stuff.
And then we can spotlight.
Yeah.
Are you okay to post the next bits in the chat, Adriana, with the case studies, or do you want to hammer that?
I should be fine, yeah.
You sure?
Let me just get that up. Yeah, I've got that up here, yeah.
It's a shame you can't have nice little neat. You probably can. You can Zoom, nice little neat links.
Oh yeah, they're quite long, aren't they? yeah, that's fine. I'll pick that one in.
Cool, lovely.
How long have they been in the breakout groups now?
So they've got 2.5 minutes left, and then there'll be a minute to count down. So
that means, okay.
So we are 3 minutes behind.
Yeah, I think that'd be fine. I think the intro to Troika, Henry, that's probably not, like, you can just give 30 seconds for them to reflect on a challenge. Okay. And also, sorry, we've got like 36 minutes for Troika when we only need.
We've got what?
We've got loads more time in Troika than we need. So make it up. I think I did that on purpose.
Yeah, I think you got contingency.
Yeah, got loads of time.
I won't join a Troika, by the way, Beth.
Okay, Super Joe, thanks.
Yeah, we've got 36 minutes when really 32, 31 is fine for Troika. So got loads of time.
Why am I so close to the camera?
Because you're keen.
Are you?
It's good, actually. No, I think it has more impact, I think, when people are centered and close. So you all look the same to me. All quite well.
I always worry that I have a far away gaze when I'm looking at my other screen.
Yeah.
It's tricky.
Yeah.
Zarina, you're picking straight up the reins after this, aren't you?
Yeah. So it's just me until I hand over to you.
Excellent.
Yeah, with the Q&A, I think if it's going really well, then we shouldn't rush it. So yeah, if you're happy for me to just stop when I think we can, and we can just sort out the timings when we're in the main room together after. Sounds fine.
They've got 30 seconds left, so we might have a few people popping back when it flashes up to say that they're closing in a minute.
Cool. Sounds good.
Great.
New person.
Oh, we've got a new person coming in.
Hi, Opie.
Hi everyone.
Welcome.
Thank you.
People have just been in breakout groups, so they're just coming back now. Welcome everyone. People are just coming back from their breakout groups. Great. I think we are nearly there. There's always the nervousness when you see that people haven't rejoined. I always wonder whether they've got lost in the ether of Zoom breakout rooms. But I think we're back to nearly everyone. So we'll make a start. I hope that was a really just nice way to connect with your peers. And thank you, Henry, for introducing the thinking framework. So as I mentioned at the beginning, today gives us the opportunity to hear from 2 case studies who have successfully worked through different issues of co-design in their digital change projects. And the aim of this is to really hear some good practice in this space. And we hope it will unlock some new thinking and just help you think about what may need to be incorporated into some of your own projects. We also hope it will spark some thoughts before you connect and collaborate with each other in your own breakout groups later on today. So I'd like to introduce you to our 2 case studies. So we're joined by Mark Beswick, National Lead for the Near Me Network in Scotland, and Chen Davies, Founder and CEO of Latchade. So thank you both for joining us today. Both of these projects are previous Q Exchange winning ideas in 2018 and 2020 respectively. And for those of you who aren't as familiar with Q Exchange, this is one of our funding programs that offers members the opportunity to apply for funding for their improvement ideas. And the reason we thought these projects would be particularly relevant learning to share is because co-design and engagement is a constant feature throughout. So Mark and Chen, thank you so much for joining us. I'll leave you to introduce yourselves in a moment and introduce your projects. But I'd just like to say to the rest of you, we're going to be spending about 15 minutes or so doing a Q&A with Mark and Chen. And as we're speaking and going through the questions, I'd really like you to keep in mind any questions that you'd like to ask them at the end of the session about their projects and co-design aspects. And we've got a couple of minutes at the end to ask these questions to Chen and Mark, whether you want to do that verbally or in the chat box. But I'd really encourage you, it's a really safe space and it'd be great to hear from lots of you then. Great, so let's get started. I think we can stop sharing the slides now. I might go on to Spotlight if that's okay there. But I'm going to start by asking Mark some questions first. So, hi, welcome Mark, great to have you.
So thank you.
It'd be great if you could just introduce yourself, your role, and give us a brief overview of your project. And also in particular, we're especially interested in hearing about some of the co-design aspects of your project.
Yeah, hi, yeah, welcome everybody. Yeah, my name is Mark Bezic. I'm the national lead for Near Me in Scotland. And Near Me is the nationally approved, freely available video platform for the whole of Scotland, not just the NHS. So it's now widely available across the whole of the public sector. So we've been working with citizens advice bureaus, social security, care homes. So it's freely available through primary care, secondary care. And my role is to support not just clinicians, but also anybody in the public sector who wishes to offer the option or the choice of a video call with whichever service they're seeking help for. So if I want a conversation with my social worker or my GP or someone at Citizens Advice, I should be able as a citizen of Scotland to, if a video suits me for that interaction, then that should be made available to me. So we're very much supporting the workforce in doing that. Now, this has been going in Scotland now since about 2016-17, when it very, very first started. It was called Attend Anywhere then, and people may come across Attend Anywhere as what it's called out in the rest of the UK. Interestingly, the initial project for Near Me within Scotland, when it was Attend Anywhere, was a co-design activity, and I'll put some links in the chat back to some of the history and some of the kind of development side of that, rather than go through all here. However, what was one of the things that came out of that was Near Me was the name chosen by the people who first interacted with Attend Anywhere in Scotland. That's what they wanted to call their video tool. So even the name was a co-designed kind of outcome, which was quite a lovely thing to kind of share. So Near Me covers all sorts of things all across Scotland, and it went from something like 300 calls a week pre-pandemic to 20,000. So we're doing 90,000 calls a month through the height of the pandemic. It's now leveled off for about 50,000 calls a month, and we haven't quite got to the point where what's the best blend of options for people accessing services if we give them a choice of phone, video, in-person or asynchronous. And that could be different for somebody working in neurology or somebody working in GP. And it can be different for that person with the same condition. Some weeks, in-person is really what's I need. And some weeks video is perfectly adequate. And sometimes a phone call is sufficient for what I need to do. But we're trying to shift from that decision resting with a clinician or the service provider with the actual person seeking help from the service. I suppose that the project, so that's the kind of big picture, and I'll put some links around the big picture. The thing I've been most closely involved with that's involved co-design and collaboration has been the launch of group consultations within Near Me. Near Me could hold about 3 to 4 people securely, but anything more than that, it couldn't manage it. So now there's a group platform, so we can do what we're doing now, but we can do it over Near Me, which has all the data protection, information governance in place. So we can have between 30 and 60 people on a call if we want, and have that group consultation. So things like the mental health groups that were running in Scotland in person pre-COVID, that all but ceased, can now run. But that was done with a great amount of co-production and co-design with clinicians and the developers, but also testing it with patient groups and getting their feedback as well. So it was a kind of three-pronged thing between developers, clinicians, and patients accessing services. And lots of testing, lots of refining, lots of gathering feedback from different viewpoints, which can be challenging when you're trying to pass that to a developer. And they go, oh my gosh, the coding this is going to involve, you know, and I had no idea how long it takes or how long it took to write stuff that worked in a computer. So I learned a lot about that. So that's probably in a nutshell in terms of an introduction. I'm a clinician myself. I used Near Me before COVID. With children and families, I worked in Shetland, which is a remote set of islands in the middle of the North Sea. And we used Near Me to connect families to our service on the main in Shetland, but also to their specialists across Scotland. So that's probably long enough. Sorry.
No, not at all, Mark. Thank you so much. That's oh gosh, I'm on the spotlight now, but that's really, really helpful and great to hear about even the co-design aspects happening right from the name. Like even that is co-designed. You mentioned that always being like a three-pronged, I was going to say three-pronged attack. That's not quite the right word, but approach rather. So, you know, did co-production with clinicians, developers and patients, testing lots of refinement and lots of different viewpoints. I just wondered, thinking about all of the co-design elements, what were the most valuable skills that really aided the co-design elements of your project?
It was a mixture. I mean, listening was a real big skill. Just listening to folk and finding out what's important to them. And patience and persistence were other things. I know those aren't particularly highfalutin kind of quality improvement skills, but in terms of engaging with people and trying to really work out what does this need to do so it works for clinicians and works for people joining. Alongside that, we did use lots of collaborative tools online. We did all this remotely. So this was all on whiteboards and meetings like this. It wasn't done in a room. It wasn't done with people live. It was all done like we're doing this now. And I used lots of things like forms and Questback and then learned how to analyze text responses, which took forever. But we found a thing called Hotjar, which helped us organize all that and produce some lovely graphs that helped us understand what are the priorities out of 600 responses to one question. How do we sort that out? So we used some of those tools and then got to learn how to use things like QI charts and what do these figures mean? What does this data over time actually tell us? So those were really kind of, and we used an equality impact assessment to engage with groups that were often potentially sidelined or had it difficult to engage and activate or use digital solutions.
That's great. Thank you, Mark. I've seen that, Seb, you've got your hand up. If it's okay, I'm going to continue asking some questions and we'll do questions to Mark and Chen, and then we'll do questions after. Is that okay? Just make a note of it. I won't forget. So Mark, what advice or lessons would you be able to share with others who are starting co-design in their digital change projects, or co-design, frankly, in projects which might not have a digital element?
Yeah. I suppose just put yourself in the shoes of the people that you're working with. I heard a great quote at a conference in Belfast recently where a guy said, you know, people find change really hard, and if you put a plug on the end of it, they run a mile. So the whole digital thing is a big culture shift for lots of people, and I think we've kind of turned our approach on the head. Rather than going to people to say, Near Me is really cool, do you want to try it? We've gone to people and said, what are your difficulties? What are your problems? And have we got a digital solution to help you with that? And that's helped with buy-in, it's helped with engagement. So it's like, what are you trying to solve? How are you trying to tackle your backlog, your waiting list? How are you going to engage with people that can't access digital? All those kind of things. So I think what's the problem? And things like, you know, data is really good at winning minds. So understand your audience, and patient stories are really good at winning hearts. And you need to find out what of those things ticks the boxes in the people that you're working with.
I love that. Thank you, Mark. Really good point, I guess, about what's the problem you're actually trying to solve, and thinking about winning minds and hearts. Beth said said something in the chat. So if anyone has any questions to Mark and Chen as we go through, please just feel free to write them in the chat. Just finally, Mark, before we go over to Chen, what does co-design mean to you, and what does it actually feel like in practice? Quite a hard question, I know.
Yeah, and I suppose that whole we'll talk about being about listening and understanding and being open to things that might challenge what you think things should turn out like. That's quite hard sometimes, is to keep open-mindedness. But I think it's something that's continuous and ongoing. It's not just at the beginning. You have to keep re-engaging and keep going back. And I think that discipline to do that. And I think hand on heart, I think I've been guilty of myself, where I've done it too late. I've done it too late in the process, and it should be at the beginning. And people often try and think about stakeholders and a bit later on. And I think that would be the thing I've learned most, is to kind of consider this really early on. And that's probably the co-design bit, is like, just do it as soon as possible. Yeah.
That's great. Thanks, Mark. Sarah, if it's okay as well, I might come back to you with your question.
Yeah, of course, of course.
I'm making a note of who's putting their hands up, so don't worry. I think your point, I saw a lot of nods, Mark, when you said about potentially you've done it, thought about co-design too late. I saw a lot of nods going around, which is something that we're hearing quite often. So Chen, if I can just come over to you, I just wondered if you could do, similar questions to Mark, if you could introduce yourself and share a brief overview of your project and the co-design elements that went into that.
Cool. Yeah, I'll quickly introduce myself and Latchate and the project. And so I'm Chen Davis. I'm the founder and CEO of Latchate. Originally, I'm not from the health space at all. I work on visual effects and blockbuster movies, having a R&D software engineer for the past 10 years, worked on most of the Marvel Studio movies. With my team, we won a couple of Oscar and BAFTA as well for visual effects. But that was all I was doing before. But what made me into this space was because of my breastfeeding challenges. So in 2015, I became a new mother to my son, Oscar, and I really struggled with breastfeeding. Before I leave hospital, already have cracked nipple. And when I went home, got mastitis and thrush. And then, anxiety of baby not putting on weight, and eventually got postnatal depression. But I have this innovation background. So I was thinking I definitely can do something to help other women. So using my CGI skill, I can develop 3D avatars to help women learn how to breastfeed. And, I can help to produce something to provide that 24/7 evidence-based support. And that's how Latchate started. So fast forwards to now. So Latchate is an app that is pioneering, is using cutting-edge 3D technology to help women learn breastfeeding skills from 3D avatars in different breastfeeding positions, in different camera angles, in anatomical view, so you can see through the baby's cheek and see exactly how the suckling works and how that deep latch looks like. It has AI-powered virtual companion, and that is using kind of the neural networks that can answer 88% of questions all the moms might ask during the pregnancy and kind of the first year of baby's life. Confidently, and over 10% of chances will pass it on to our team of experts to give that wraparound support, and that will be used to train AI again to make it even more robust. So it's very scalable. And we also have a virtual support community for moms to talk to each other, to give each other that peer support, especially at 2 a.m. in the morning when you are struggling and your baby is screaming. And going back, sorry, just very quickly, we have got users from 93 countries already, and we have been funded by 3 Innovate UK grants. We have very luckily won the Q Exchange grant, which helped us to set up our pilot with 4 NHS integrated care systems last year, and we have got a really great success. So we are currently commissioned by 2 ICS on a very smaller scale. We'll try to expand it to kind of bigger areas. So when I prepared this webinar, I was thinking about the co-design aspect for the Q Exchange project, but I'm happy to share the co-design aspect when we created this app with moms as well, because we have support from moms and dads from all over the world, thousands of them helping us train AI, testing AI with all sorts of questions. So like building a fishnet, and we see lots of gaps at the beginning and eventually smaller and smaller gaps, and AI become more robust and less stupid, and eventually, we don't need experts to come in all the time to answer questions. So yeah, happy to give any more kind of context about this.
I guess, thank you, Chen. That's really helpful and great to hear how it started and the project's onset with your own experience. I guess you were saying about the co-design aspects. There was lots of support from parents, testing AI, seeing the gaps until it was more robust. I guess, are you able to share any more about some of those co-design elements of your project? And also, what were the most valuable skills that aided co-design?
Okay, I want to split it in half. So one half is how we co-design with users. One half is how we co-design with our NHS partners. So firstly, with our users, we have run, at least from the beginning of LATCHET, probably from 2019 when we started to, actually second half of 2018, we have run about 4 user evaluations. At the beginning, we only had sketches. So sketches and kind of wireframes and show women, this is the app, what do you think? And then gradually had alpha version, the beta version. Every stage, we'll do the shout out on social media. We'll recruit loads of moms from everywhere, let them try the product, tell us exactly what their challenges and needs are, and what other things they don't really care about. So we don't have to spend a lot of time developing it. One thing I really want to share with everyone is a book called the Mom Test book. It's a little pink book you can get from Amazon. So designing this kind of things is very important to ask the right questions. Imagine if you ask your mom about anything about you, they would not, your mom won't say bad things about you. So asking customers or potential partners about any questions, you need to frame your questions really well so that you can get the objective right answers you need to develop the product well. So going back to the kind of co-designing with NHS partners, this is mainly about our pilot projects, because in the past 6 months, we have piloted, I mentioned, with 4 ICS. So we have got 724 new pilot area users join the program. And we actually demonstrated really good health outcomes. Our reported outcome is double the national average for the breastfeeding rate at 6 weeks and so on. So how do we co-design with partners? It's very important at the very beginning, before any pilot project, discuss with them what the KPIs are, what the success looks like. So for every single ICS area, we talk to the commissioners and we talk to the clinical leads separately to understand what they care about. So this includes, for example, the health outcomes, breastfeeding rate, at 6 to 8 weeks, or initiation rate and so on, mom's feeling of self-efficacy. This might include how much gap this app is trying to bridge. For example, the 24/7 aspects. And then we try to understand their needs and challenges. So all the KPIs they tell us, we design this into our evaluation and implementation framework. And we co-design with our partners what this implementation framework looks like as well. For example, how they are going to prescribe apps to families at different checkpoints, for example, antenatal checkups or postnatal checkups, and co-design what kind of questions we could ask in the questionnaires.
That's great, thank you, Chen. I can see some activity in chat. I was scribbling down some notes. If you're able to share in the chat afterwards that book you recommended, that would be quite helpful. But I like the point about asking the right questions, framing it well, and then discussing KPIs, what success looks like and what people care about. It's what we hear quite often, and it's good to hear it again. Just finally, before I open the floor to everyone, what advice or lessons can you give to others who are starting co-design in their projects?
Some points I have mentioned before, start the co-design at the very beginning of the project when you are planning the project, understand what the kind of success look like, and make your project together. I mean, for me, I'm from the industry, I'm working with NHS partners. I don't want to make the project single-sided because, our NHS partners are busy, but we try to solve a problem with them to make their life easier using digital solutions. So we want to make the project a joint project. So really set up the regular communications to show them these are the KPIs. We use infographics and reports every month. We use emotive case studies because we know for a very overloaded midwives, the best thing they can see is some stories to show that the outcome is improved, moms are helped, infographics to show them some very quick overview of the improved bigger picture, that will really motivate them to help you implement this even more. Another thing I just mentioned before is the kind of agile process, design iterations, have your users at the heart of design something at the very beginning, so you are not developing something that people don't really need or want later on, because it will save you money. And finally, I just want to remind everybody about that book called The Mom's Test. And that really helps, and it's a little book, and it's helpful for everything, whether or not you are co-designing or not, help you to frame the right questions.
That's amazing. Thanks, Chen. I know that our team will be going on Amazon to try and find that book quite soon. So if we could remove the spotlighting, Beth, if that's all right, I just wanted to open up the floor. I've seen there's a couple of questions coming through. I know Seb and Sarah, I said earlier on that I'd come to you. So, so Seb, did you have a question? I don't know who that was for. I think that might have been about any advice around digital co-production.
That's exactly it. So both talks were brilliant. Thank you very much. This was specifically to Mark because I use Attend Anywhere. I think it's fantastic, but unfortunately it does create that digital divide. Specifically about Scotland, I was hearing from Jason Leach last week about how the Glasgow effect is there, the post-industrialisation effects, that if you're born into poverty, or you're 14 times more likely to die early than if you're not born into poverty, and that's widening, that's getting worse. We have a local travelling community which we really find difficult to engage with using digital solutions and Attend Anywhere. So I was just wondering if you had any tips on engaging with the 10 million people in the UK that don't have digital access, and how we can work with them or engage with them to co-produce and developing digital solutions, because it's really tricky, because we want to advance everything that we do, but not to the detriment of those that can't afford to access them. So I'd really appreciate any tips or advice.
Yeah, you're absolutely right. This is a big issue for many people. If I want to have a video because I don't want to travel, or it's really difficult, it's expensive for me to travel, and I want to have that. So with that in mind, in Scotland, we have a thing called Connecting Scotland, which is a grant awarding organisation. So you can nominate individuals or community groups to receive connectivity. So that could be devices, it could be broadband. So there's ways of meeting the needs of certain communities in certain places by Connecting Scotland. We are acutely aware as a promoter of digital solutions that we are in risk of leaving people behind. So the Scottish Government are very keen to try and address that. Connecting Scotland is one example. But we've realised that there are many places people can go to near home that if they want to have a near me call with a professional, they could perhaps go to their local community centre or the library or the leisure centre. So I don't, and there, if the four barriers that people came up that told us in Scotland to accessing digital was I don't have a device, I don't have connectivity, I don't have the skill, or I don't have a safe private place for which to have a conversation in my home. So we've taken those four elements and say, okay, what can we do so someone can go and have all or one of those four things near home? So I don't have to necessarily go to Glasgow from the Highlands. I don't necessarily have to take a bus across town. I can have that. So we've got a long way to go. We haven't cracked it yet, but we've got lovely. I've put a link to a webinar, and there's some lovely community groups in the back of Beyond in Scotland who have got a little room in their village hall, and Mrs. Smith can come, and someone who from the village can help me get online, and I can have a conversation with my whatever it's going to be. But libraries is our next big thing. We've got 10 libraries piloting near me. So you can go to your library, and again, you can have a device, you can have connectivity, you can have help. And there's 400 libraries across Scotland, and most folk live not too far from a library. So that's the other place where hopefully you can go. But yeah, it's going to be an ongoing challenge as more stuff goes digital, and there's still going to be people who either choose to or can't for whatever reason.
That's great. Thank you very much, Mark. That point about libraries actually is interesting, because that's come up in some of our lab projects about that being a place where people can't access digital devices at home, but they're thinking about how to implement new technologies using libraries. Sarah, I think you had a question as well.
I did, but it was a very specific question. I just want to pick up on that library bit. It makes me smile that libraries are having their next iteration, and there are also hubs that are in GP practices where they've got volunteers supporting as well. So I think that sounds amazing. Both presentations, absolutely fascinating. I'd actually like to say, if it's all right, Zarina, there's a question from Sabrina in the chat that actually picks up on a point that's really important, the 1239 one, about interested in how non-NHS co-designs with NHS, anxiety within the NHS, how to promote Latch.me, you know, it's paid for, etc. Don't know if I'm allowed to promote it within the NHS service. So I'm working in the Dorset Innovation Hub, and what we're trying to do is implement innovation adoption. We're funded by the Health Foundation. And that fascinates me, Sabrina's question. So I wonder if we could hand to Sabrina, and if there's time at the end, I'll ask my question.
Yeah, that's fine, Sabrina. And then Chen, I know you might have some thoughts on that.
Yeah, I mean, Chen has just replied in the chat saying that it is a free app. I think working in the NHS, and you know, Chen, I mean, coming from someone who works for Marvel and who works in, like, you know, a high budget, I think it must be really interesting for you coming to work in the NHS. Working in the NHS is a bit like, you know that learned helplessness, the circus elephant kind of thing, where healthcare professionals, supposedly quite senior, like myself as a consultant, actually, like, I feel like I need to ask for permission before I can promote Latch.me, even though, like, looking at it, and I'm sure it's a very good product, and I can completely empathize with the whole breastfeeding problems. It is constantly on our radar about what women want and support, and it frustrates me immensely, so much so to a point now we're having a lot of anti-breastfeeding rhetoric because it's so hard just to give women what they need, which is the support. Now we've gone the other way and saying, no, we shouldn't even be telling women to breastfeed. If you look on Twitter, you know, we shouldn't even be pressuring them to breastfeed because it makes them feel rubbish, rather than just give them the thing that they need, which is the support. So I feel the need for your product, but as an NHS doctor, consultant, I feel like unless it has the RCM badge on it, unless it has the RCOG badge on it, and that blue and white NHS ugly as anything logo, uninspiring logo on it, I don't feel like I'm allowed to promote it. I mean, I can secretly tell my patients to go to it, especially if it's free, but I don't know if we're allowed to, like, you know, splash it all over our boards unless we have that formal connection. And I'm wondering if there's any work that you can do to help with that permission piece, because I think that might be a barrier to widespread adoption.
Thank you so much, Sabrina, for your really great comments, especially that kind of helplessness of, you know, women need support. They need support when they need it, you know, and we want to be there for them 24/7. So we actually work with 4 academic health science networks in West of England, in Wessex, in East of England, and also going to set up the connections with KSS soon, and setting up more and more pilots up and down the country. So usually what we do is that we speak to the kind of infant feeding leads and innovation leads. So infant feeding leads of the kind of NHS integrated care systems or trusts, and we speak to the innovation lead of the academic health science network. And after introduction is made, we will have set up one-to-one meetings with these leads to explain the product and understand what they need to see in order to gain approval for the partnerships and for the pilot. It's generally quite straightforward. We are not a medical device. We don't, you know, the regulatory kind of requirement is much less, and we are ORCA certified as well with a high score. So we have already run pilot with 12 NHS providers. So generally, it's pretty safe to start another pilot with another area. And the pilot is completely free for the NHS partners. The cost is on us. Luckily, last year we got Q Exchange funding. So the cost is actually from the Q Exchange funding. So we're very grateful for that.
Great, thank you for your questions, Sabrina and Chen. I'm conscious of time, we've flown by. There are 2 more questions I wanted to pick up on in the chat. Susanna had a question about what are the benefits and drawbacks of bringing different stakeholders together versus engaging with them separately. And I think that Chen and Mark took different approaches. So yeah, I don't know whether, Susanna, you wanted to expand on that, or Chen and Mark, you have any thoughts?
Yeah, thanks, Serena. Yeah, I'd ask the questions. My limited experience of co-design before, it's quite often about bringing those different stakeholders into the room together. And I think that's what Mark was describing, perhaps in some of the, although he did it online, and some of the approaches that he took. And Chen, I think you mentioned that you had your different stakeholders in different groups and engaged separately, and I can understand why. So just wanted both of you to expand on that a little bit and talk through what perhaps were some of the benefits and drawbacks to taking those two different approaches, if I've understood right. Thank you.
To go first. I suppose I don't have to hand on heart. I don't think it was a conscious decision. I think it was like, how can we do this in the situation we're in when we're all scattered across Scotland? Our developers are in Australia. So I think it was very much a logistical kind of decision rather than a conscious, how do we get this done? So I think I don't think it's any more complicated than that in terms of the rationale behind how we manage that.
Thanks, Mark.
I will share some feedback about why we speak to clinical leads and commissioners separately, because they have different needs and they have a different they are after different things. I think clinical leads are generally, they're very pro supporting breastfeeding or kind of improving the health outcome, but they want to use your solution, but they don't know where to find money for it. They don't know how to pay for it. They don't know the system that well, and they are stressed out with all the kind of pressure from everyday's work. I think clinical commissioners are thinking differently about the budget, the contract, the overall picture of what kind of supports are already available in this particular area. For example, I'm in Gloucestershire. They're thinking about, there are some funded services already, there are something else, and do we need to pay a little bit more money for this? And then they think about health economics, they think about the business case, they think about how much money, how much time, how much result that can be saved using the very, very little limited funding from the NHS bank. So I think because they think differently, we need to talk to them differently. And also it's very hard to get the schedule for both sides of people to be in the one room. That's why we talk separately.
Thanks, Chen. It's helpful.
Great, thank you. I will give Mark and Chen maybe about a minute to answer Joe's question, if that's all right. I know Joe had a question in the chat about funding for co-design. So even with Q Exchange projects, we see ideas coming in at early stages, but still co-design isn't as much of a feature in this early stage development as perhaps it could be. How do you get funding for co-design when you won't really know what the intervention or product will be if the co-design is genuine? Have I said that right, Joe? I said that right. Yeah, Mark and Chen, do you have any thoughts about that?
I'll go first because I have to leave very soon for another meeting. So in terms of the funding, it's always a tricky one, but we were quite lucky to apply for the kind of the Innovate UK funding and some other kind of funding from the NHS improvement and so on. But I always think if we eventually become, as a company, we become financially sustainable, like break even, so on, the startup, we'll always ring fence some funding for the co-design, and so that we can guarantee that whatever R&D we are doing, whatever direction we are going, it is because of the needs from users, from our service users as well, for example, the NHS partners and so on. So sorry, might not be very relevant for NHS colleagues.
Thanks, Chen. I don't know, Mark, if you had any thoughts.
I suppose I was fortunate that Near Me is nationally procured across the whole of Scotland. And I suppose that the group element of it came as part of the contract. So we haven't had to pay extra for that. And it was the most requested feature all through the pandemic, is when can we have more than 5 people on a Near Me call? So I suppose at that side of things, because it was nationally procured, nationally approved platform, then the permissions were already in place in terms of what does it need to do for the people of Scotland.
That's great, perfect. Thank you both. I think I can speak for everyone on the screen for saying that's just been really, really insightful. Lots of questions coming through. And hopefully if people have any questions, any further questions, we could always contact you, Mark and Chen. But I just wanted to thank you. That's been really, really great. And we look forward to seeing how your projects continue to progress over the years to come. I know, Jen, you've got to dash off now, but yeah, thank you very much. I'm now going to hand over to Henry. We've been running over a little bit, so we've got slightly condensed time for the breakouts activities, but yeah, I'll hand over to Henry. And if Adriana can share the slides.
Thanks so much, Serena. Yeah, and just to echo that, I really enjoyed that and I learned a lot. So thank you, Mark and Chen. So in a few minutes, we'll be moving into breakout groups of 3 people, and we'll be using a liberating structure called Troika Consulting to guide some conversations. This is a method that can help with peer-to-peer coaching and can help people gain insight on issues they face, and can help with discovering solutions, reframing thinking, and sort of refining ideas. So we'll be doing these sort of quick round robin consultations, and individuals will share a topic or an issue that they're seeking the consultant's help or advice on. And so using this model kind of enables not only the person being helped to get the valuable advice, but also get help too in the process for others, since the tips come out in a sort of open manner. And the method can just open up more informal insights that people might shy away from in a more formal format. So what's the ask? Well, we'd like you to just reflect on a current challenge or issue you're facing around co-design in your digital change project that you wish to seek the views and support of others on. You may also want to reflect on the case studies just now, and if they prompted any new thoughts for you, that's also fine. You'll be allocated to breakout rooms with 2 other people, and there'll be 3 rounds of consultation. You'll have around 8 minutes per round, just because you've switched times a tiny bit. And just make sure that you introduce yourself to others in your group first to get going. So the roles within the group are, we have the client. The client is the person seeking help and support for an advice. And the consultants, of which there are 2, will reflect on the issue and share thoughts. So just in terms of a brief outline shared in the chat as well, start by identifying who will be the first client and the 2 consultants. Then the client will share his or her issue, just briefly, up to a minute. And then consultants can ask any clarifying questions for the next minute or so. Then the client turns camera off and listens to the consultant's conversation. And together, the consultants generate ideas, suggestions, and coaching advice. And that's really the bulk of the time, sort of 5 minutes of time. Then the client turns camera on and shares what was most valuable, what they've heard. So hopefully you can see how that all comes together in a nice way. After that, group switch to the next person, who will be the client, and repeat the steps. And just note that the timings on the slide have changed slightly, so they may be slightly different on the slide to the ones I've just laid out. And I also just wanted to add that if you don't have a challenge or issue that you're grappling with, totally fine to sort of use the allocated time to reflect on the case studies with each other and add any new thoughts that they stimulated for you. For example, did it prompt any thoughts and what emerged? There will be some groups of 4, so in this case, pieces spend slightly less, just a minute less each, I think, overall. Before we go into those groups, just going to have a 30-second pause to sort of individually reflect on a challenge or co-design that you might bring to the breakout group. So yeah, just to pause, starting now.